Gain, gross and microscopy explained. I hope you people are able to identify a couple of pictures on the screen, not the chessboard. The topic for the day is cirrhosis, and it has got a spectrum of importance starting from the specimen of the slide, chart, viva voce, etc. Also, on the theory front, you have got essay, short note, MCQ in surgery as well as pathology. Hence, I would like you people to read this in concurrence with RATS. This is just for the sake of recall. I find that there is an yellowish specimen. I'm not going into the details of it, a fatty liver. And microscopically, I find that there are multiple ballooned out cells, namely the fat within the hepatocytes. This I would like you people to go back to RATS. It is part of an essay question itself. Again, a description. It is a mounted specimen of the liver. Any medical college will be having this. And it measures dash into dash into dash centimeters. Any specimen, kindly measure it. Then the external surface. It is brownish gray in color. I always play with these colors. When I say brown, the examiner will say why it is not gray. When I say gray, the other way around. Put it as brownish gray, you are safe. Firm and consistency. It is very obvious. We might not touch it, but we can feel it. The external surface is nodular. So look at this one, multiple nodules are there throughout. And it is called a hobnail pattern. Hobnail is something like a boat pin or a nail on the shoe. I shall be showing you a picture of it. The nodules vary in size from dash to dash centimeters, which means it can be micronodular, macronodular, or mixed nodular. So kindly note the measurements. So this is a normal liver, so smooth it is, but here I'm finding that there is a nodularity involving all the lobes throughout the external surface, and when I cut it, again I'm able to appreciate the parenchyma separated by fibrous tissue. So these are the things that you people will have to describe. Please draw this picture. So again, try to learn the drawing part of it. There is another specimen of the liver, and I'm finding that there are multiple nodules, varying sizes. Some nodule is quite large, but the main important thing is it is firm in consistency. The yellowish tinge is no longer there, and the nodules are throughout the surface. The size obviously will be shrunken because of fibrosis. And this is the classical hobnail that I've been talking about. So this kind of an appearance is seen, and I would like you people to draw the cirrhosis as well as a hobnail. Coming to the cut surface, all the pale areas, the yellowish white or the yellowish gray areas are the hepatic parenchyma, and they are all being separated by grayish black areas of fibrous septae. From a distance, I will be able to appreciate it much better. So there are two colors. The paler color is the parenchyma, the darker color is the septae. And it involves the entire cut surface. That is another point in favor of the diagnosis. There are no areas of hemorrhage or necrosis. However, there might be a carcinoma because hepatocellular carcinoma rarely can give rise to a malignancy. Please find out whether your specimen has got that. You'll have to describe the external surface and the cut surface. Compare these two. Earlier also I had shown you a picture, but look at this one. So this is a Porter triad. I am able to find multiple elements. This is the central vein. These are all the radiating parts of hepatocytes. This is supposed to be the limiting plate, which we normally do not see. But I'll be able to appreciate it when I compare both the sides. So periportal region is called as zone 1, middle is zone 2, and the perivenular is zone 3. So this is a normal architecture. What do I mean by the word architecture? It is the relationship of one part of a tissue to another. That is called architecture. But look at this one over here. I'm finding nodularity, a small nodule and 3 large nodules. They are being separated by dense fibrocollagenous septate. There is no central vein that can be seen. And the portal triads are also out of place. So this is called an effacement of architecture. Effacement means loss. Effaced architecture, nodules of varying sizes, hepatic vein and portal triad, not prominent but out of place, dense bands of fibrous tissue. This is extremely important, and there are no areas of hemorrhage or necrosis. A superb picture again from a closer view. You people can appreciate the nodules much better. The key point is throughout the hobnail pattern. And look at this. There is some remnant of fatty chain, but predominantly it is becoming solid. This stain is called the mesenteric, which can appreciate the collagen and the fibrous tissue, blue in color. And this is a classical hobnail. This is a nail on the shoe which prevents it from wear and tear. That kind of an appearance the liver has got, and hence it is called a hobnail pattern. And this kind of a slide can be kept as a chart for you people. I'm finding multiple nodules, no central vein, no portal triad, broad bands of fibrous tissue that is separating. This nodule is quite small. So hardly any inflammation, necrosis can be seen. So this is a case of cirrhosis. And a must treat for you people will be rats. See you in game 56.